Hello, how are you, everyone? Welcome again to today's iCON forum, our online webinar, Take Charge of Your Health, Living Well Together with Diabetes. I am Barbara Ho. I am the Chief Nursing Officer of iCON Chinese Division and your host today. Today's topic, the theme, again, has to do with diabetes. iCON is, the office is situated on the traditional, ancestral, and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh peoples. We would also like to acknowledge that you are joining us today from many places, near and far, and acknowledge the traditional owners and caretakers of those lands. iCON is an initiative of the UBC Faculty of Medicine. Let's start with Digital Emergency Medicine Initiative. The main purposes are through organizing health seminars, workshops, and using web technology, we can help multicultural the public to know more about prevention of diseases, and also for those who we can instill knowledge for using digital technology to manage your chronic diseases. We hope that we can give you accurate and reliable information for everyone to share. We hope that not only local public can share with this, we hope that through the webinars, we can also spread the knowledge to far and remote places so that everyone can strive to improve our physical health. So now let us go back to Joseph Leung's video. Dr. Leung is going to talk to us about how to control blood sugar and the importance of preventing complications. Because we know that diabetes patients have also complications that can affect their body. So let us listen to Dr. Leung now.
So hello, everybody. Yes, I'm Dr. Leung. I'm the diabetes doctor working at VGH. Yesterday, we already listened to Dr. Ma, Gloria, our dietitian, and Laura, a diabetes nurse. And we have heard the informative and in-depth information about diabetes. And today, let's continue. So today, we are going to talk about diabetes, how diabetes affects the different parts of our body. And also, we will learn about how to prevent complications. And finally, we're going to talk about what treatment options, what are the ways that we can do to treat diabetes. So yesterday, Dr. Ma talked about what diabetes is. Diabetes causes the body to have high blood sugar. And diabetes may not display symptoms. And sometimes even when the blood sugars are very high, patients may not detect it or may not feel any symptoms. However, if symptoms show up, sometimes it can be fatigue, thirst, feeling weak, having headaches, dizziness, or frequent urination. So if these symptoms do come up, it would be better to make an appointment with a specialist and check the blood sugar and see whether you have diabetes. For diabetes, there are different types. Mostly, when we hear, would be type 1 diabetes, type 2 diabetes, and gestational diabetes during pregnancy. So every diabetes is slightly different, and usually among people of advanced age, we would see type 2 diabetes. So today, I'm going to concentrate more on type 2 diabetes. For type 1 diabetes, usually requires the use of insulin, and other medication may not help. And usually it is diagnosed during childhood. And today, we are not going to touch on type 1 diabetes. So for type 2 diabetes, it can lead to many different complications. So why are we so concerned about diabetes? It's because of all these complications because of stroke, heart attack, and also high blood sugar and diabetes can affect mental health and also cause other suffering. So our next presentation by Dr. Tigerson Young will present on that aspect, and then I'm not going to touch on this. Diabetes can cause damages to our blood vessels. So in our body, there are bigger blood vessels and smaller ones. If our bigger blood vessels are being damaged,